Hi guys, I got my second chemo treatment on Friday, December the 27th, which was a couple of weeks ago. In the last episode I said I would talk about my chemo a little bit in the next episode, so here you go. We'll talk about it a little bit today. I'm getting a combination of immunotherapy and chemotherapy. I get 2 drugs for the chemotherapy and 1 drug for the immunotherapy. For the immunotherapy, I get Keytruda. Immunotherapy is supposed to help your immune system fight cancer cells. Then for the chemotherapy, I get pemetrexed, I believe that's how you say it, and I get carboplatin, and I've got a little blurb there on screen kind of telling you what those 2 drugs are supposed to do for me for the cancer. You might have seen Keytruda advertised on TV. They advertise it quite a bit. It's one of those drugs you see the ad and there's a gazillion side effects. A lot of them sound really serious. Some of them are even fatal. And you think, why would I ask my doctor to give me this? But those kind of drugs, generally, apparently the doctor tells you need to try taking it. Something most people are at least somewhat aware of is that chemotherapy is not good for your body. Your oncologist will make that a little more explicit for you. Mine told me that with chemotherapy, they're basically giving you poison in an attempt to kill the cancer cells. And of course that poison can affect the rest of your body. He told me it's a trade-off and a calculated risk that with chemo you will live longer and have a better chance of beating the cancer than you will without chemo. But it's always up to the patient to decide whether they want to take that risk. And most patients will take that risk. My oncologist told me this course of treatment that they're giving me is the best option for lung cancer, and they've had great success with it. And I'm fortunate that my cancer hasn't spread anywhere and I'm able to get this course of treatment, so of course I opted to do it. My chemotherapy sessions take about 2.5 hours. They give me the Keytruda first, and follow that with some steroids and anti-nausea medication. And then they finish up with the 2 chemotherapy drugs. They also give me steroids to take at home the day before, the day of, and the day after the therapy. They told me the steroids would probably make me feel really good for a couple of days right after the chemo, and that is exactly what has happened. I felt energetic and really good. The 3rd day after both sessions so far is when the chemo has hit me. I wake up tired, and as the day goes on I just get more and more tired. And after both sessions, the first 2 or 3 days, I took naps in the afternoon just because I was so tired and had so little energy. So I feel that way for, say, 3 or 4 days, and then I start feeling a little bit more back to normal. They've given me plenty of anti-nausea medication, and I really haven't had trouble with that. Besides what they give you during the therapy, they gave me 2 different prescriptions of anti-nausea to take home with me and use. One of the many possible side effects from these drugs is numbness in the feet and hands, and that is one that I did get, especially after the first treatment. My feet burned and they hurt when I walked. They felt really tender. That's eased up quite a bit. It was almost gone before I got my second treatment, and it's come back a little bit, but it's not nearly as bad as it was the first time around, or I've just gotten used to it and don't notice it as much. As I mentioned in the last episode, I get 4 chemo treatments, 21 days apart, 3 weeks between each treatment. I feel in that respect I'm luckier than a lot of people who get chemo who may have 3 or 4 sessions in 1 week, and then they'll get 2 or 3 weeks off before they do it again, where I'm only getting 1 treatment and getting 3 weeks off, which gives me plenty of time to recover pretty well before the next treatment. Another note about my treatment, my oncologist told me with the drugs they're giving me, I probably won't lose my hair. That most people who get them don't lose their hair, and as you can see, it's all mostly still here. I do feel like it might be thinning out a little quicker than it usually does. I hate to say it, but losing my hair was one of the things I was most worried about with the chemo, of course. So far my side effects have been pretty minimal, although they have been a little worse after the second session than they were the first session. The tiredness, which my oncologist told me that's one thing he can guarantee will happen to everybody who gets chemo. That's definitely been there. The burning feet, as I mentioned, which seems to be a little better this time around. The biggest complaint I've got right now is I've been losing my sense of taste. I found out pretty early I can't eat spicy food, and a lot of food I eat, it just doesn't taste like anything, which makes it kind of hard to eat, and so I got to try to add some flavor to it, but I can't add spiciness to it. I can add salt, but I have to be careful or whatever I'm eating just tastes like salt. Anyway, if that's my worst complaint, I'm better off than a lot of people who get chemo, and the nurse I had the first session told me she's been a chemo nurse for 25 years, and back when she started they used to have to admit people to the hospital while they were getting treatment because the side effects were so hard on them. So I picked a good time to get cancer, I guess, if there is such thing. Anyway, that kind of fills you in on my chemo treatment. In the next episode, I'd like to talk a little bit about mental and emotional health and toll that cancer takes on you and on my family. I feel like it's at least as hard on them as it is on me. That's all for now. Stay tuned, and we will see you next time. Thank you.